My name is Yotamu Chirwa, and I work with the Biomedical Research and Training Institute, and normally we refer it in acronyms to say BRTI in Zimbabwe. Basically, I want to talk about the work that we did on health worker incentives. Underpinning this research was the desire to understand how human resources for health respond to crisis in Zimbabwe, but also in other countries. We were looking at post-conflict and how it affects health worker availability. So the study wanted to understand what decisions were made during the crisis period and how those decisions would then affect processes after the crisis in the case of Zimbabwe. So basically, I think the key issues that came out was that when the economy is not functioning well, social services tend to be ignored in terms of funding. So funding for the health sector during the crisis almost disappeared. And the first thing that happened as a result was that health workers working in underserved areas, rural areas, increasingly left their posts. Not to other new posts, but some virtually stopped going to work because they couldn't afford to go and work and then not get anything out of it. Then after the crisis in 2008, partners began to come in because there was a government of national unity. They wanted to assist the health system recover from the particular problem which had led to collapse. And several measures to incentivize health workers were taken, including general reprieves for those that had just stopped coming to work. They didn't go through any disciplinary processes. They were readmitted into the service to provide services. Partners came up with a retention package to help health workers be appreciated better, and also at the wider national level, we adopted the US dollar as a currency to pay people, and this helped health workers to really begin to appreciate coming to work because at least the US dollar was stronger and it did not suffer from the inflationary pressures that were there in the country. So eventually this helped revitalize the health system after the crisis. And the lessons that we learned from that is that health workers are a special category of people, and you need very strong policies which are properly funded to ensure that they stay in their jobs. And also we also observed that it is important to keep adequate human resources, routine information, which is accurate, which is collected timeously, so that this can be used by human resources planners and managers to make decisions. So that is a very important thing that needs to be focused on. And we also realized that while the retention package that came in after 2008 had positive effects on the health worker pension, availability, motivation, there was need to make sure that that retention becomes embedded within the whole compensation structure. In other words, it should become part of the salary. if it were to be a sustainable solution to health worker retention, the policies that are in place need to be reviewed, particularly those policies that allow various providers to pay salaries that are much higher than those that are paid in the public sector, so that we don't create that internal dynamic which then forces health workers to move to other organizations because they are paid better than. Because this leads to poor distribution of available skills within the health system, where you find highly skilled people working in low-level facilities, primary facilities, because they are paid better there. Yet the kinds of health problems that are being dealt with at that level do not require such skills. They require maybe lower skills. So in a way, if you don't deal with the salary disparities, you end up destroying the entire referral system of the health system. So I think that is very important for us to think about going forward. Thank you.